Hello, thank you for visiting Children's Emergency at KK Women's and Children's Hospital. We have put together this video to help you understand more about nosebleeds, also known as epistaxis, what you should do when this occurs, and when to seek help if needed. Why do our noses bleed? Nosebleeds can be scary but usually causes no harm to children. Children usually bleed from the superficial and thin blood vessels that can be seen at the front portion of the nose on the septum, just behind the nostrils. This group of blood vessels is also known as the Little's area, where many blood vessels confluence together. Hence, this area bleeds easily when traumatized. The most common causes of nosebleeds are dryness of the nasal lining, nose picking, allergens, colds and injuries. Rarely, nosebleeds can be caused by bleeding disorders or tumors. Nose picking may also increase the frequency of nosebleeds. The dryness of the nasal lining can also be triggered through frequent exposure to air conditioning, which increases the risk of nosebleeds. Nosebleeds from the Little's area may last until puberty. After puberty, nosebleeds usually decrease as the nose lining thickens from hormonal changes. What should I do when my child develops nosebleeds? Your child should sit up, lean forward, and pinch the lower soft portion of the nostrils for 5 to 10 minutes while breathing through the mouth. The action of pinching the nose bridge can be done either by yourself or your child. Bending the head slightly forward helps to allow your child to spit out any swallowed blood through the mouth, if any. An ice pack can be laid across the nose bridge and the forehead or on the cheek to help stop the bleeding with constriction of the tiny blood vessels. The majority of nosebleeds should stop during this time. If it restarts, compression to the same area can be applied again for another 10 minutes. The idea is to keep the heart lower than the nose so blood flows back to the heart and not to the bleeding area. What other measures may help in reducing my child's nosebleeds? Other alternatives include that of applying petroleum jelly with cotton buds to either side of the nasal septum at night to reduce the episodes of nosebleeds. Your child should also be advised against frequent nose picking to prevent trauma to the affected area. You can consider using a humidifier to reduce the drying effect of the air conditioning. When should you bring your child to the emergency department? You should bring your child to the emergency department if you note any of the following: massive bleeding, if the nosebleeds does not stop despite attempting self-care steps, if it happens after recent nasal surgery, if your child is on medications that prevent clotting such as aspirin, if your child has multiple bruises or other areas of bleeding, or if your child is pale, fatigued, or disoriented. If your child's nosebleeds are very frequent and or troubling, you may consult an ear, nose, throat specialist who may be able to further assess and advise you on other treatments for such nosebleeds. If your child refrains from nose picking and other contributing factors are removed, this usually allows for 6 months to 1 year of symptom-free period. To sum it up, it is not likely to be of serious concern if your child's nose bleeds once every few months. Even with proper precautions, children can still get nosebleeds occasionally. So if your child gets a nosebleed, do not panic, especially if it stops easily with the measures described earlier. However, if it happens regularly, for example, 4 to 5 times a month, your child should be reviewed by a specialist to rule out any of the rarer causes of nosebleeds. If there is a large amount of bleeding that does not stop with the measures mentioned, bleeding or bruising in other areas of the body as well, you should seek immediate medical treatment. We hope that you feel more confident in looking after your child with nosebleeds after watching this video. Do also refer to the pamphlet provided for the details. Thank you.